Mrs. Dowd. I have the penicillin that Dr. Wayne ordered for you. Are you allergic to penicillin?
Always provide explanations to the patient about the injection and check to be sure you are giving the right patient the correct medication. Reconfirm that the dosage, route, and time also are correct. Then help the patient into the appropriate position and expose the injection site. Protect the patient's privacy throughout the procedure. 5 different sites are used commonly for intramuscular injections. The dorsal gluteal injection site is located to the left or right and slightly above the midpoint of a line between the posterior superior iliac spine and the greater trochanter of the femur. The dorsal gluteal site is used for adults, but not for infants and children. The patient lies on his stomach with the toes pointed inward and the arms toward the head. The ventral gluteal site lies in the V between the anterior superior iliac spine and the iliac crest. The needle is passed through the gluteus medius muscle and into the gluteus minimus, which lies beneath it. To find the ventral gluteal site, place the palm of your hand over the greater trochanter of the femur while the patient lies on his side or back. When the middle finger touches the iliac crest and the index finger is placed on the anterior superior iliac spine, the injection site is within the V formed by the 2 fingers. This site may be used for all patients. The vastus lateralis injection site is on the lateral aspect of the thigh, midway between the hip and the knee. The rectus femoris injection site lies beside it on the anterior aspect of the thigh. The vastus lateralis and the rectus femoris sites are used for all patients, especially children. The patient may lie flat in bed or remain in a sitting position. The mid-deltoid injection site lies within an imaginary triangle on the deltoid muscle on the patient's upper arm. Both the brachial artery and the radial nerve lie near the mid-deltoid site. The mid-deltoid site can be used while the patient is lying down, sitting, or standing. This site is seldom used for intramuscular injections because the muscle can only accommodate 1 cc or less and because of the proximity to the radial nerve. Select the best site for the injection. Site rotation is necessary for patients requiring frequent injections. Then clean the skin with an alcohol wipe to remove any surface contaminants. Use a circular motion beginning at the center and move out toward the periphery. Remove the needle guard, being careful not to contaminate the needle. Use the thumb and index finger of your non-dominant hand to gently stretch the skin taut over the injection site. Hold the syringe like a dart in your dominant hand. Insert the needle at a 90-degree angle using a smooth, even movement of your wrist. Pull back on the plunger to be sure the needle has not entered a blood vessel. If blood is aspirated, remove the needle. Then select a different site using a new needle. Slowly and steadily inject all the medication and the air bubble using even pressure. Place an alcohol wipe near the insertion site and quickly remove the needle. Cover the site with the alcohol wipe and gently massage the area using a circular motion. Massaging the site is not recommended when slow absorption of the medication is desired or if it is irritating to the tissues. Place the needle into a puncture-resistant container. If any blood appears at the injection site, apply a Band-Aid to the patient's skin. Be careful not to touch the blood with your fingers.
Mrs. Dowd, we're all done now. You can turn over. Let me help you.
Check the patient in approximately 30 minutes for any side effects or problems associated with the injection and carefully record the nursing care you have performed. The right documentation has been added by several authorities to the traditional 5 rights that must be ensured whenever administering medication. These 5 rights are the right patient, the right drug, the right dosage, the right time, and the right route of administration. The medication record and the patient's chart is both a medical and a legal record. The medication given, route of administration, date, time, and anatomical location for the injection must be recorded. The nurse's signature on the medication record and her initials next to her signature are also important parts of this documentation. The Z-Tract method for deep intramuscular injection may be used to administer medications that are very irritating to tissues, such as Infraron. This method helps to keep the medication in the muscle tissue and away from subcutaneous tissue. Once the injection site has been determined and prepared, be careful not to touch it. Use the ulnar side of your non-dominant hand to pull the skin laterally to displace the layers of tissue above the muscle. Insert the needle at a 90-degree angle and aspirate to determine if you have entered a blood vessel. Do not release tension on the tissue. Maintain the traction and inject the medication slowly. Wait approximately 10 seconds to allow the medication to disperse, then withdraw the needle and immediately release traction on the tissue. If there is any bleeding from the site, wipe the area with a dry cotton ball or gauze square. Avoid touching the blood. Do not massage the site afterward.